Depression is an illness that affects the way a person feels about him or herself, what they think about, their eating habits, and their sleeping patterns. This illness involves a person's thoughts, mood, and body. Depression is an illness that can be treated through medication, counseling, exercise regimens, diet, hospitalization, or a combination. It is not an illness that can just go away or that you can just pull yourself out of. A person suffering from depression loses interest in activities that they once found enjoyable. Some signs and symptoms of depression are loss of appetite, overeating, loss of emotion, persistent feelings of sadness, anxiety, social withdrawal, fatigue, and physical problems. Also, thoughts of death or suicidal attempts. A medical diagnosis for depression will only occur after a person has suffered from these symptoms for at least 2 weeks. Depression can be caused by multiple factors. Some of these factors include a chemical imbalance in the brain, stressful life events, medications, genetics, and medical problems. It is further believed that some of these factors interact together to bring on depression. However, in some people, these symptoms go away. This leads them to becoming oversensitive or insensitive, which could cause an effect on the mood. Mood is affected by dozens of genes, and these genes turn on and off at the right time to make the right proteins. But if the gene gets it wrong, that could result in an unstable mood. In a genetically vulnerable person, stress can push the system off balance. Temperament also shapes behavior. This behavior is determined by genetics, along with experiences a person has had during their course of life. One's viewpoint is developed early on and is reflected on throughout their life. If a viewpoint is one that is reflected on a negative emotion or is self-critical, it may have an effect on the person suffering depression. Life deals everybody stressful events, like death, loss of a job, illness, or even a failing relationship. Stress plays an important role in depression, and genetics influence how sensitive people are to those life events. When genetics and stressful life events come together, depression can result. Depending on the length of the stress-related event, the human body can either return to normal or the body will get stuck in an overdrive and be long-lasting when the stress is chronic. Profound early losses, such as the death of a parent, can have a lasting physical and emotional consequence. Researchers have found emotional trauma makes individuals more apt to become depressed later in their life. Children that have been physically or emotionally abused have changes in their brain functions that lead to symptoms of depression and anxiety. Moreover, medical problems are linked to significant mood disruptions. Two of the most known medical problems that trigger depression are hyperthyroidism and hypothyroidism. Heart disease also has a significant link to depression. Other medical conditions that alter moods are multiple sclerosis, Parkinson's, Alzheimer's, strokes, lupus, and cancer. Furthermore, medications can also affect mood and bring on symptoms of depression. Medications that may cause depression are drugs that are commonly used to treat heart and blood pressure, hormones, insomnia, infections, pain, and cancer. Although most people who take these medications will not experience mood change, if depression is in family history, a person is more vulnerable when taking the drug. Several forms of depression exist, and they develop under different circumstances. The first type is persistent depressive disorder. This mood disorder lasts 2 or more years and may have major episodes along with minor ones that tend to be less severe. Another form is psychotic depression. A person that suffers from this disorder will have severe depression along with delusions and hallucinations. Delusions are a false reality in which a person feels that they are in charge. Hallucinations could range from hearing voices in the head or mind and seeing objects that really aren't there. In addition, there is bipolar disorder, also known as manic depression. A person with bipolar disorder will experience euphoric moods and irritable moods. A person with bipolar disorder may feel energetic, abnormally happy, and make reckless decisions in the manic state, but during the depressive state experience hopelessness, frequent urge to cry, and have a negative outlook on life. With bipolar disorder, the depressive state may lead to suicidal thoughts or change to feelings of euphoria. These extreme mood swings can occur every week or maybe just twice a year. Postpartum depression is another mood disorder that can affect women after childbirth. Mothers that are experiencing this type of depression have extreme feelings of sadness, anxiety, and exhaustion that makes it difficult for them to care for themselves or others. Due to the level of hormone changes in the mother's body after childbirth, it triggers chemical changes in her brain. These changes can result in postpartum depression. One last type of depression is called major depressive disorder, which is the most commonly diagnosed form of depression. The primary symptom of this depression is having an overwhelming depressed mood for over 2 weeks. The depressed mood affects the person's ability to work, socialize, get motivated, and participate in normal daily activities. Someone with major depressive focuses solely on the lows or negative emotions. Depression is a highly treatable disorder. The earlier it is treated, the less time it will take to relieve the symptoms and prevent reoccurrence. To begin with, a physical exam will be completed along with a check of the family medical history. Some medications cause depression, and those will need to be ruled out. Once a person is diagnosed, there are many ways to treat the disorder. The most common treatments are medication and psychotherapy. Studies show psychotherapy along with medications prove to be highly effective. Physical exercise is also a great technique to combat depression, along with improving your everyday diet. Consuming vegetables, greens, and protein, and reducing the amount of sugary foods and alcohol can lead to a reduction in depression. Depression is a common and treatable disorder. Although it is not yet known how to prevent depression, research efforts are expanding in new ways on how to successfully combat it. Mood disorders can cause extreme impairment in everyday activities and have symptoms lasting for more than 2 months. Several types of depression exist, and a plethora of symptoms that help to properly diagnose the disorder. Depression can be treated through medication, counseling, diet, exercise, and a combination. Taking the steps toward treatment for depression can be very difficult, as it requires a person first must recognize and acknowledge that their symptoms are caused by depression. However, once steps have been taken to get treatment, using one or a combination of techniques, recovery is possible. For people living with depression, this involves making changes in managing their lifestyle so that their depression will not reoccur, and if it does, it will be easier to manage.